Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Menosuria or menouria. Menosuria or menouria, it is hematuria at the time of menstruation is menouria or menosuria. This is seen in endometriosis of bladder or if the fistula connecting the uterus to the bladder. If the fistula is connecting the uterus to the bladder, then the menstrual blood during menstruation from the uterus it goes to the bladder and it comes out as hematuria at the time of menstruation. This is called as ureterovesical fistula and the hematuria which is seen is called as mensouria or menouria.
This is actually uterovesical fistula. So whenever there is uterovesical fistula, this is uterus and this is, okay, I'll draw it again. Okay, this is bladder, this is the uterus. Whenever there is a fistula between the bladder and the uterus, then we call it as uterovesical fistula. In this uterovesical fistula, the bleeding will start from the uterus during the menstrual bleed and it goes into the bladder. So from the bladder through the urethra, the blood comes out as hematuria. So there will be hematuria and at the same time the patient is also menstruating. So there will be hematuria with menstruation, that is menosuria.
thank you and thank you for watching.